And joining us now to talk about flu season in the era of H1N1, there's Dr. David McKeown, Medical Officer of Health for the City of Toronto. Thanks for sparing some time for us tonight.
Good to be here.
Why don't we just start by having you remind us what the difference is between the good old-fashioned regular flu and swine flu?
Well, swine flu, or the pandemic H1N1 strain of flu, is merely a new strain of influenza virus. Influenza viruses change from time to time. They mutate genetically. And what we're experiencing globally now is a new strain that we haven't seen before.
But it's more virulent?
Only a little. The good news about H1N1 is that the pandemic we have is not the pandemic we've been preparing for. Countries in the southern hemisphere who've just come through their main flu season have experienced a little worse flu season than they usually do.
How exactly is that the good news? I must have missed something there.
Well, we've been preparing for a number of years now for a very severe pandemic, and it's possible that with a strain that is much more virulent and many people have not been exposed to, we might see really severe illness and many more deaths. Fortunately, N1N1 is not that pandemic.
The shot you would get, the vaccination for H1N1, and the shot you would get, as many people do every year for the regular flu, are they similar?
They're similar. Now, every year what happens is there's a decision made based on the best judgment of what strains are going to be circulating to develop that year's flu vaccine. This year's flu vaccine, for example, contains 3 different strains. It was produced before H1N1 emerged. If the timing had been a little different, H1N1 probably would have been in the regular seasonal flu vaccine.
Are you recommending that people get vaccinated for H1N1 now?
As soon as it's available, yes. Now, there are priorities that the federal government has set out for people who are most at risk, which includes healthcare workers, young children, pregnant women, but it really is for everyone who wants it once those priority groups have been immunized.
But it's not available for another month yet, right?
Well, we're hoping that it'll be available by the beginning of November. My staff are gearing up now to be able to offer the vaccine in clinics across the city.
Do you recommend people get a second vaccination for the good old-fashioned regular flu that we've been dealing with for years and years?
Well, the seasonal flu vaccine is recommended, and it's starting to be available in Toronto now. It is recommended for those over 65 and living in long-term care facilities. We'd like to get them who are most at risk of the regular seasonal flu immunized before we move into H1N1.
But at the end of the day, you are asking people to get 2 separate vaccinations this fall, is that right?
Well, we think that probably the main virus that's going to be circulating is going to be the H1N1, so that's where we're putting our emphasis. But we're carefully monitoring which strains are circulating, and later in the season, we may make recommendations to go back to immunize with the regular seasonal flu if it's circulating in the community.
So first and foremost, H1N1 next month when available, and then we'll see after that. Is that the way we go?
Yeah.
Okay. Bottom line, though, if you're young, if you're healthy, do you need a vaccine at all?
Well, there's an advantage to getting the vaccine even if you're young and healthy. You may be all right with the flu, but you're going to come into contact with people who might not fare so well. So very young people, the elderly, people with chronic illnesses. We have an interest in reducing transmission of influenza throughout the community to protect those who may become very seriously ill.
Okay, I think we've got that figured out. Let me go on a bit of a tangent here somewhere else. We had a strike in Toronto this summer. A lot of public health concerns because of that strike. Garbage didn't get picked up for 36 days. For you, in public health, what was the big lesson?
Well, you find out what people think of public health services when they don't have them for 6 weeks. A lot of attention was placed on garbage. From my point of view, the garbage piles were managed in a way that nobody's health was put at risk. I was much more concerned about the suspension of other kinds of services. There are a lot of vulnerable people in this city who depend on public health services, particularly newborns, high-risk pregnant women, families who don't have access to other services. Those services were not delivered for 6 weeks, and I was becoming very concerned. I was very pleased when the strike came to an end.
With the benefit of the kind of hindsight that you now have, we're several months past that, do you have a view as to whether or not outside workers ought to be made essential and therefore denied the right to strike for public health reasons?
Well, taking away the right to strike is a pretty important policy decision, and we haven't weighed in on that. But I do believe that public health services play a very important role in the community, and we should do everything we can to preserve them, even during a labor disruption.
Okay, but you're not taking position on the right to strike?
Not at this point.
People wanted you to recommend, I mean, you know this, a lot of people wanted you to recommend over the summer that somebody step in and end this thing for public health reasons. Never got that far in your view?
We were getting close towards the end of the strike. We were able to manage the public health issues that occurred during the strike up to the time when the settlement was reached.
Safe injection sites. They have them in Vancouver. There are feasibility studies, I gather, going on with regard to Toronto. What would your recommendation be for those here?
Well, City Council in Toronto adopted a drug strategy which includes several different measures: enforcement, education and prevention, treatment, and harm reduction. Now, the purpose of a supervised injection site is to reduce the harm that comes along with the use of injection drugs. There's only one in North America that's operating right now, and that's the one in Vancouver. It has been evaluated carefully and found to be very helpful in reducing overdoses, in taking injection drug use off the street into a safe environment. Now, Vancouver has a very particular kind of drug problem that's very concentrated. Our situation here in Toronto is different, and it's not yet clear whether a supervised injection site makes sense for the City of Toronto.
So you're not making a recommendation yet?
That's why well, the recommendation was that we take a look at it, and there are a group of independent researchers who are studying it right now to make a recommendation.
And do you have a view on it one way or the other yet?
I'm keenly awaiting the results of that feasibility study to see what it's going to tell us.
Okay. We're going to have a big discussion on the other side of the studio in a few moments about government and junk food and the advisability of the government's telling us or advising us what we should be eating or not be eating. So let me get your views on some of these things before we have that. A ban on advertising junk food to kids. You're in favor of that, right?
I am, yes. We know that if you look at the kind of advertising that our children are exposed to, the vast majority of food advertising is for foods which are calorie dense, nutrient poor, not the kind of healthy foods we all want our kids to eat. We also know that advertising works, that children's food preferences, what they eat, what they ask for, and in fact what they do is altered by that advertising. Lastly, we know that children under the age of 8 are probably not cognitively able to distinguish the intent of advertising. They don't necessarily get that there's someone trying to persuade us to do something which may not be good for us. And children under 4 can't reliably distinguish between ads and the programming that they're watching. So it's not really a fair target for advertising.
Would you want government to pass a law banning those ads where? In schools, on television, newspapers?
Well, ideally everywhere. Parents who are really trying very hard to get their kids to eat a nutritious diet are having to compete with a very well-organized, well-funded effort which is trying to persuade their kids to eat unhealthy things. We don't think that's fair.
Can you really do that? Can you ban those kinds of ads everywhere?
Well, the province of Quebec has done it for many, many years now. There's a comprehensive ban on all advertising to children in that province.
But you're the medical officer of health for the City of Toronto. Could you ban this kind of activity only inside Toronto but not anywhere else in the province and have it be meaningful?
Well, probably we're looking at a provincial or a federal legislation to accomplish this goal.
Kids come into, I shouldn't call them kids, young people come into contact with fat and sugar and salt all the time. And even if you banned it, they'd get it somewhere, right? They'd get it at the hockey arena, they'd get it at their friends' houses, they'd sneak it, when their parents, it's just omnipresent, isn't it? Is this a fight you think you can win?
Well, it's a fight that's going to take a comprehensive approach. Banning advertising is only one component. We have to change the environment in which kids are making these kinds of decisions. Not only advertising, but what foods are available in schools and school cafeterias, what kind of education we're giving kids about how to make nutritious choices. It's going to take a major change in society. We've seen that happen with tobacco. We've seen it happen with drinking and driving. It's something that's worth pursuing because it'll make a big difference for the health of our children and the adults they become.
What kind of headway are you making so far, do you think?
Well, the issue is being discussed pretty widely. It's going to take a while to get there, I think, because the food industry is very interested in continuing advertising to our kids.
I was going to ask you, what do the advertisers have to say about this?
Well, they generally say that they're acting responsibly. But when we look at what's actually out there and what kids are exposed to, it's not good for their health.
These are legal products, right? These are legal products which, I'm trying to make the distinction here between smoking, which has no redeeming qualities whatsoever, right? There's no healthy way to smoke. But there's a healthy way to have a chocolate bar if you have one a week or something like that, right? So can you really make that kind of equating between smoking and junk food and say we're taking the same approach for the same reasons?
I think you can avoid a situation in which kids are being exposed to advertising that they're not going to be able to respond to in an age-appropriate way, and level the playing field between parents who are trying to get their kids to eat healthy and the industry which is trying to do something different.
Okay. Dr. David McKeown, please, if you would, join me on this other side of the studio. Others are going to want to have at you on this as well, so we'll continue the discussion over there. Thank you.